Hello everyone, thank you for coming today. I'm Dr. Azham. I'm the Medical Registrar in charge of Miss Zack, and I've been taking care of her. I just want to gather everyone today because I would like to explain what actually happened to her and what we have done to treat her and what we can do to prevent it to happen again. Okay, what happened is Miss Zack actually presented to us with shortness of breath, and considering her advanced kidney disease and also underlying ovarian cancer, she actually have a severe fluid overload. So what happened, because of her advanced kidney disease, her kidney have failed to remove the extra fluids and also waste inside her blood. And because she is having shortness of breath and severe fluid overload, to save her life and to save her heart and lungs, we have to put her on an urgent dialysis. So what happened is, the dialysis would actually help her to remove the extra fluid and excess and waste, and will correct her blood chemistry and electrolytes, and also remove the fluids in her lungs. Okay, so that's why we need to do the urgent dialysis. But as you all know, during her dialysis, Miss Zack actually developed seizure, which is quite uncommon, but it can happen to someone as unwell as Miss Zack. So what happened when we started off the dialysis, she was fine, but eventually we noted that she have the blood pressure suddenly dropped and she developed a seizure. We actually attended her immediately, and we have to stop the dialysis. After we stopped the dialysis, we tried to secure her airway and also support her breathing. Okay, and then we actually try to correct her hypocalcaemia, which is a low of calcium in her blood, and also give her fluids to restore her blood pressure. And alhamdulillah, her condition was had improved, and she's currently quite stable and comfortable. Okay, so I just want to explain to everyone that this condition is quite uncommon, but it can happen for someone that have never done a dialysis, especially in Missy's situation. She actually this is the first time underwent a dialysis, so there is a sudden drop in the excess fluid, which leads to a sudden drop in the blood pressure. Okay, and also when there's a sudden removal of fluids during dialysis, there also a sudden removal of the calcium in the blood, which leads to muscle spasm, and in her case she developed a seizure. Okay, but however, she is currently very stable and comfortable, and we want to assure you that the next time that she requires dialysis, we will taper down her needs for dialysis, and also on a slower pace, and also monitor her closely, and check her vitals more frequent, and make sure that we have someone to look after her during her dialysis. And also we will also have an input from our nephrologist regarding her current condition and also her dialysis plan. All right, so I think that's all from me. I will be happy to receive any question from any of the family members. Okay, so if there is no question, I would like to thank everyone for coming today, and if you do have any question, feel free to approach us. We try our best to provide the best care for Missy. Thank you.